Megan Lozier with Lincoln Health. I'm the Marketing Director and Public Information Officer here. I'm not on the camera, so hopefully you guys can see me. Today we have a great panel of experts here from the hospital. We're going to talk about two subjects. The plan today was just to talk about resumed visitation and what that might look like here at the Care Center and Assisted Living Center, but with Governor Polis's announcement, we will be discussing the mask order as well. I'm going to have you guys go down the line and introduce yourself and tell us what it is that you do here at Lincoln Health.
I'm Tonya, Lemley. I'm a social worker here.
Carrie, Owens, Director of Nursing Administration and the Interim DON for the Care Center.
Brianna, the Vice Chief of Staff on the Family Medicine position.
Jessica Weeks, Director of the Assisted Living and Director of Activities.
Erika, Saffer, Nursing Home Administrator and Chief Operating Officer.
Awesome, thank you. So the first thing we're going to want to address is probably right on the front of everyone's mind is Governor Polis's mask mandate that he released at 12:45 today and goes into effect at midnight tonight. I'm going to turn it over to Brianna Fox, Dr. Brianna Fox, I'm so sorry, to talk about that one.
Okay, so it's new information. I'm giving you the information as we received it from the governor as well. But overall, and just in general, our hospital does support this. We do think that it will help support our local economy by helping keep people healthy and keeping our businesses open. So we definitely want to see that continue. Some just bullet points from it is that the mandate is that people 11 and older in public indoor spaces are going to be required to wear a mask. He's requiring businesses to post signs and refuse to serve anybody that are not wearing masks. So that's kind of the biggie. He does list some exceptions if you go to his governor page as far as who does not need to wear a mask. And you can go ahead and check that out. But like I said, I want to reiterate that we do support this because we think that it will help keep people healthy and keep our businesses open and keep the economy going. That's pretty much on the mandate. I just wanted to give you guys some updates on cases in Colorado and the US, and then we'll talk about Lincoln County in just a second. So in Colorado, this was as of like noon today, we've had a total of 38,155 cases. Nationwide, we've had almost 3.5 million cases. In the last 24 hours, 67,000 of those are new. In Colorado, for COVID-only deaths, some people have been concerned that there's been deaths that weren't necessarily because of COVID, and maybe they had a heart attack, but they also tested positive for COVID after the fact, but it wasn't due to COVID, so those numbers have been removed. But in Colorado, we've had 1,601, and in the United States, we've had almost 137,000, almost 1,000 of them are new within the last 24 hours. So in Lincoln County, as of today, we have had 6 confirmed positive cases. We have 3 tests pending as well. So that's the newest and the latest on that. Testing wise, the state public health testing is about 7 days out. So when you get swabbed, it's taking about 7 solid days to get results back. Hospital wise, when we do the swabs and we send it out, it was taking about 3 to 4 days to get back. We're up to 10 to 12 days now. We were testing people before they were getting surgical services. Sometimes the surgeons want them tested and they need the results. It's usually within 3 days. So we can't do that anymore at this point in time. We're hoping once the backlog is caught up, we'll be able to resume doing that for folks. But for right now, you need to talk to your surgeons or whoever the specialist is that's requiring this testing, because you're going to have to work with them to get a test that will meet their guidelines and be satisfactory for them.
Perfect, and I'm glad you brought that up about the backlog. There's been some mention about rapid testing and why don't we have rapid testing? At this time, the only approved rapid testing is for antibodies, correct?
Correct.
And that is not going to give you the kind of answers that you need to in order to receive any kind of procedure.
Correct.
Okay, good. I just wanted to address that ahead of time. Thank you so much. And these, obviously, what we all are aimed towards keeping our economy open and our residents safe. These returning numbers have implications on where we stand right now in our variances as a county. I won't attempt to answer all those questions or preemptively answer those questions, but those things do matter to what our social events, our businesses being open, how we can remain open. So this is important. Patsy Smith says only indoors. What about fair, and who will take care on lists of people attending the fair? So not sure. Patsy, could you kind of?
I think
go ahead.
Masks only indoors. I think she's talking about that.
Yes, the mandate is for only indoors at this time. But the second part of the question is what I'm confused on.
I think like maybe she's talking about a log of people who, kind of like contact tracing.
That is a good question, Patsy. I'm probably gonna have to answer you afterwards, and I'll post the answer here because I know as far as the concert is concerned, every attendee has their information, address, telephone number is collected before they can attend, so that contact tracing can happen in the worst case scenario. But I'm not sure about fair, so we'll get back to you on that. And hello, Mark and Holly and Carvel. So let's move on to our topic at hand today. It's talking about the much anticipated visits at the care center and assisted living. And I'm going to turn it over to Erika.
So good afternoon. We are excited and nervous to roll this out at the same time. I first want to take just a minute to thank all of our family members, friends, church members of our residents in our care center and our assisted living for being understanding. I know it's hard to be patient because you want to see your loved ones. So thank you for helping us stay safe at this time. I do want to talk about the reason why we are starting to do these scheduled visits. We have been monitoring our residents all along for their emotional well-being, and we are starting to see just some concerns with the residents and their emotional health at this time, and so we felt like it was time to start allowing some connections, and I will go through those details here in a minute. I'm going to ask Tonya Lemley to kind of talk about emotional health and what that looks like in our care center right now.
Sure. As we go through this and as we've segregated families from their loved ones in the care center, the residents have done really well so far, but after a few months it's starting to wear on them. There is a little bit increase in depression, a little increase in hopelessness, helplessness. Family connections are very important and crucial in emotional and social support, especially when someone is in the care center. When residents do not have contact with their family, they may experience lots of different things.
Tonya, can you guys hear Tonya? We're having lots of can't hear you, and I'm not sure if it was when Erika was talking. Okay. I just want to make sure. Can you guys hear Tonya? Just keep going and talk as loud as...
She said no.
Okay.
So some of the residents when they don't have contact with family, sometimes they experience fear and anxiety around worry about what's happening to their families in the community and themselves. They worry about different things like what's going on out there because they don't know. They're stuck in here and they don't have family visiting them to tell them that. Sometimes they experience changes in eating and sleeping patterns, and we've noticed a little bit of that. Difficulty sleeping or concentrating on different things that they like to do. Say they used to like watch TV or listen to music. Some of the residents have declined in that area. Sometimes they have worsening or increase in emotional health as well as their physical symptoms. Some residents voice a concern that living like this is not worth it because they don't have that connection. So those are some of the reasons why we've decided that we need to minimally open this up to where we have one person visiting them at this time.
Jess, did you have anything you wanted to add about their well-being, just mental and their quality of life?
So we've been really trying in the care center and as well as at Lincoln Park to create different activities and stuff to give them that purpose, because not seeing their loved ones is obviously difficult. So we started, we have a greenhouse going that they love to go look at. We have roses, whole bunch of vegetables and herbs. We've started doing jewelry making with them. We started armchair travel. We went to Greece last month and we're visiting the 13 colonies this month. So that's been really fun and exciting for them. We do movies and popcorn, sensory items, and this is all on a one-to-one basis. So there'll be an activities person strictly with that resident, and we hit all of them every day, twice a day, to keep, you know, their spirits and stuff up like that, which is important.
To be clear, we are not hitting residents. She spends
see
time
them
with
twice
them
a day.
twice a day.
Encounters? Encounters. We have encounters.
We visit them twice a day.
Okay, so, just moving forward, I am gonna, bear with me, there's a little bit of information here. I wanted to kind of list off what, these scheduled visits are going to look like and, the process that is being put in place and the policies that are put in place for us to keep staff and residents safe. So, and please understand this is a kind of a fluid process. We have seen the need to roll this out, but things are apt to change, either more conservatively or more liberally as we go, and we will address that on a case by case and literally day by day basis. So, the first point is that the visits must be scheduled in advance. Right now that's with Trish Poole, our ADON, and Tonya Lemley from Social Services. During the call, you will be screened and interviewed for symptoms, exposure, and travel. And then you will also receive a little bit of education on COVID as well. Right now we are only allowing the power of attorney or the co-power of attorneys to visit. I know that's not what you all want to hear, but we've got to start somewhere. We hope to be able to loosen that, but again, we've got to do this on a day-by-day basis. There will be no more than 2 visitors allowed at one time with a resident. The visits right now are only going to be Monday through Friday so that we can monitor these with the proper staffing. We are trying to keep it between 8 a.m. and 4 p.m. and we're going to look at 1 hour in duration for each one of these visits. If you show up unannounced for a visit, we will not allow you to come visit your resident, and I apologize for that, but we have a lot of planning and safety measures put into place to prepare for this. So please don't be frustrated if you show up and we say, we didn't have you on the calendar, let's get you on the calendar, and then we know you're coming. Unfortunately, because we are doing our visits in outdoors, in the case of inclement weather, we may need to reschedule the visit. This again will be on a case-by-case basis. We will make sure we have your proper contact information and be in touch with you about that. So all visits are going to be on the back patio, and this of course is the long-term care. I'll let Jess speak to assisted living here after I'm done. We will have a designated area. The visitors are not to approach any other staff or other residents while they are here for the visit. And we will try to limit the activities they're out on the patio at that time, so to kind of ease that situation. Just like this has been for our staff, visitors come to the east patio to be screened outdoors for symptoms, temperature, and exposure. All visitors will wear a face mask in the proper manner for the entire visit. You will be escorted around the back patio to the designated visitation area, and then visitors Of course, you have, for social distancing, you must stay at least 6 feet away from the resident at all times. We can't allow you to do any hugging, hand holding, or physical contact of any kind. We're working on a system to enhance voice volumes, because we do have some residents that are hard of hearing, so we're working to address that. While allowing audible privacy for the visits, we are asking that our staff to visually monitor each one of the visits, and this is just to ensure that infection control and social distancing guidelines are being followed throughout the visit. After the visit's complete, of course, we will be using EPA-approved disinfectants to treat the patio furniture and any other surface that has had contact. And then there's going to be limited exceptions to the above guidelines on a case-by-case basis, as well as for end-of-life situations.
Perfect. And just if you want to kind of talk about obviously, one thing I'd like to put out there for our listener, or our viewers today, is that much of this was set forth by the state. These guidelines are what we are required to abide by. We have to make it work for our facility, obviously, so slight tweaks here and there, but the monitoring has nothing to do with invasion of privacy, but just because that's one of the guidelines that we are required to meet. What do your visits look like within these guidelines at Lincoln Park?
So Lincoln Park, we're going to start allowing visits August 3rd. Pretty much we have the same guidelines and everything as the hospital care center. We are only going to do Mondays and Wednesdays for right now, and that's just because of staffing issues, but it's pretty much the same. They will have a check-in, we'll get them all screened, and then there will be a private area for them to visit with a staff member.
Okay, perfect, thank you.
And the care center, we are aiming to start this next Monday, the 20th. And Jess, did you already say that? I missed it. August 3rd?
Yes, and then Lincoln Parks
Okay.
is August 3rd.
Okay.
And we need to address this. We understand, guys, we really do. We would love to be able to let everybody see their loved ones. But we have a new case in Lincoln County today, and our main goal is the well-being, both mentally and physically, of our residents. So it doesn't mean that this rule of POA and co-POA is forever. We may not be able to continue with the policy that we have set in place right now. This may be too lenient. I understand how heartbreaking that is for those of you that do not meet those requirements at this time, but again, it's our job to care for these people, and that has to be at the forefront of any policy that we make. And then that leads us to, if in the unfortunate case that there are increased numbers locally, kind of speak to that, and then what we'll have to do.
Well, we've been looking at guidelines. We've been talking with public health, talking with our providers. All we can tell you right now is especially with these new cases, we will stay in collaboration with public health. We will continue to collaborate with our providers, and we have to do what's best, considering our community. And on the flip side, if curve starts flattening out, I'm going to be positive here for a minute. Curve starts flattening out, and the visits are going well. We will do our best to start allowing other family members to visit. So, but we have to put safety measures into place to limit the number of people that come into the care center at this time, and we will try to move from that as time allows.
Well, just to put it into perspective for some of the people listening today, I am, as a big old pregnant lady in a at-risk population as well. I haven't been in the care center since February, so I have not set foot in the hallway. This is not something that we just are putting on family members. We are taking these precautions very, very seriously. And another, to speak to the numbers that, Dr. Fox shared with us at the beginning, of our live, is we have had 2 positive cases in 1 week. Now we're talking about numbers less than 10, but that's the most we've had in a week since, we've had a positive case in Lincoln County. It is serious, it can affect us, we are not exempt, so we have to continue to be, cautious.
And I think too, for those people who are wanting to see, we can have Zoom parties. At Lincoln Park, we just had a huge birthday Zoom celebration. So there are ways that we will, and you can see, I know that it's completely different than seeing somebody in person, but at least you're getting to see, we have a big screen in the conference room downstairs, we can, have a party, and, there's other ways to be uplifting and stuff during this time.
Yeah, I thank you so much for bringing that positive light on there. Absolutely, we have, our technology here will allow us, for you to be able to meet with your loved ones. I know it's over the internet, it's not the same, just like Jess said, but we could do, Facebook now allows Facebook groups. So if you have family members all over the US or in different states, everybody can be together, seeing each other on the same screen, and that will do a lot for our residents.
Mm-hmm.
So please reach out.
Roxy, we have a huge screen. It's major.
It's 5 feet by 4 feet, so she should be able to see it.
Yeah.
And like I said, it's not the same, but please call us. We will make it happen. Let us know what needs to happen and how we can make those Zoom meetings, Facebook meetings, whatever kind of conference call, Google Hangout, whatever technology you guys have, we will make it happen with our residents.
Mm-hmm. Yeah.
We just wanna make sure that we're keeping the residents safe and that we're doing, we have an obligation to all of our residents. So and again, they're all in the high risk category, so 80 plus, you have a 40% death rate in that group of people. And so one incidence of COVID can be devastating to the entire population in the care center. And we've been able to keep them safe thus far, so we just want to keep doing that. So we ask that you do your best in public, be safe, wear your mask, good hand hygiene, do your part so that we can get to a place where we can get people in to see your loved ones.
Absolutely. Absolutely. And I know it's not everybody's favorite thing, but it's our personal responsibility to be gracious to our neighbors, and then specifically this population of our care center and of our community. Do we have any other questions that we have not addressed today? These policies we will get posted in a very clear format on our website. If people have any questions, then we can post them on Facebook as well.
It's gotta be approved by next time.
Oh. Well, we're almost there. They'll be posted publicly.
We're close.
And again, that opens tentatively Monday, July 20th at the Care Center and August 3rd at Lincoln Park. We are reachable through our Facebook if you have questions after Facebook Live has ended, or if you want things you want us to address next week. Please let us know. I know this is kind of a pregnant brain, someone help me. Happy but sad.
There you go.
There you go. Oh, okay, I have a question. Can you tell us if the 2 active cases are tied to the same source within the same family? No, they are not. They are separate cases. Oh wait, actually, I don't know. Active cases. If you're saying confirmed cases, recent confirmed cases of this week, no, they are not. The 3 cases that are out right now, I don't know if I can speak to those. We'll leave that question to Gilbert. Christy Payne asks, who do you contact if business is not following mandates of masks of masks and distancing? You need to contact Lincoln County Public Health, and they will let you know where to go from there, or they will take action. I can post Gilbert and, who is our, Joe Beth Mills, who is our Lincoln County Public Health Director, her contact information here in chat. But that would be who you contact. Alrighty, guys. See, we're so good at this. We're ending 6 minutes early. Does anyone else have any more questions before we say goodbye for the day? Alrighty. Well, thank you all for joining. I want to thank our panelists for taking time out of your day. We appreciate everything that you guys are doing. Hey, if you like these guys better, let us know. You can rank them, rate them below. All right, everyone have a wonderful afternoon, and we'll see you next week.